Good day, sir. I'm Mark Aldred Labarias of BSMT 2-YC-6. Today, I'm gonna discuss about HIV age screening and testing signs and symptoms and prognosis. Importance of HIV testing for prevention of HIV infection. People with HIV who knew their status can get HIV treatment called antiretroviral therapy of ART and remain healthy for many years. Studies show that the sooner people start HIV treatment after diagnosis, the more they benefits. HIV treatment reduces the amount of HIV in the blood called viral load, reduces HIV related illness, and prevents transmission to others. People with HIV who take HIV treatment as prescribed and get and keep an undetectable viral load or stay virally suppressed will not transmit HIV to their sex partners. People who get tested and learn they don't have HIV can make decisions about sex, drug use, and healthcare that can help prevent HIV. Taking HIV medicines called pre-exposure prophylaxis is highly effective for preventing HIV. HIV tests for screening and diagnosis. HIV tests are very accurate, but not tests can detect the virus immediately. After infections, how soon a test can detect HIV depends on the type of test being used. There are three types of HIV tests: antibody tests, antigen or antibody tests, and nucleic acid tests. Antibody tests look for antibodies to HIV in a person's blood or oral fluid. Antibody tests can take 23 to 90 days to detect HIV after exposure. Most rapid tests and the only FDA approved HIV tests, HIV self-tests are antibody tests. In general, antibody tests that use blood from a vein can detect HIV sooner after infection than tests done with the blood from a finger, stick, or with the oral fluid. Antigen or antibody tests look for the both HIV antibodies and antigens. Antibodies are produced by a person's immune system when they exposed to viruses like HIV. Antigens are foreign substances that cause a person's immune system to activate. If a person has HIV, an antigen called P24 is produced before antibodies develop. Antigen antibody tests are recommended for testing done in labs and are common in the United States. An antigen test performed by a lab on blood from a vein can usually detect HIV 18 to 45 days after exposure. There is also rapid antigen test available that is done with a finger stick. Antigen tests done with the blood from finger stick can take 18 to 90 days after exposure. Look for the actual virus in the blood test. Should be considered for people who have had recent exposure or possible exposure with early symptoms of HIV and have tested negative with an antibody or antigen test. And that can usually detect HIV 10 to 32 days after exposure. An initial HIV test usually will either be an antigen test or antibody test. If the initial HIV test is a rapid or self-test and it is positive, the person should go to the healthcare provider to get follow-up testing. In the initial HIV test is a lab test and it is positive. The lab will usually conduct follow-up testing on the same blood sample as the initial test. Although HIV tests are generally accurate, follow-up tests allows the healthcare provider to confirm the result